Yeah, I would like to inform the viewers that Dr. Saravanan and Dr. Mahalakshmi Saravanan, they are replicating the success story which in Abu Dhabi very soon. So I would like to understand from them personally how different they will be from the centers which are already here. And if you see the pricing factor, which is a major hindrance for a lot of couples to take these services, especially fertility side services. If you see their incidences, they are almost out of 100 couples, as per the research recently done here in Abu Dhabi and UAE, experts, embryology expert and fertility expert, they say like almost 6 to 7 couples are having this infertility issues, and they can't afford because insurance doesn't cover that. So what do you, how different you will be from the other medical centers?
So what the couple expects from us, which nobody can be denying, is the one thing they ask from us is, can I become a parenthood? Can I attain parenthood? Is success is 100%. So what the medical practitioners say is, what is the current situation? What is the live birth rate? What is the clinical pregnancy rate? What is the biochemical pregnancy rate? So what happens is, when we are going to explain all these things, they become very disheartened of spending so much of money, and I'm not going to get the assurance. So here we have to make them understand, along with assurance, give them the right counseling, advice, guidance and directions. So our concern is, the center in GCC countries are having so many facilities and all the latest equipments and technologies. But we as a practitioner, we have to make them understand, we have to give lot of motivation to the couples, give them the assurance, and then give them the treatment that will definitely increase the success rates, number one. And number two, we have to definitely give them a very cost effective treatment at with all the facilities. And number three, what I'm just looking forward is, success in many centers looks like a pregnancy, but to me it's a parenthood. We have to give them the lot of focus after the pregnancy in terms of care after the pregnancy, because many times they slips off, they don't get a fetal heart rate, they don't get a viable pregnancy, they get lot of miscarriages, so, and they get lot of abnormalities, they lose the child in the second trimester. So our success looks at looking at getting a baby to the hands. So we need to really go to the completion. Apart from giving a treatment and getting a pregnancy, we have to look forward to take to them to the next level of delivering the baby and give them a safe confinement. So we are focusing in all these activities, which we feel still needs lot of attention in the current situation.
Correct. Very interesting, very interesting. So I would like to ask Madam to tell the viewers, like, what do you advise to the viewers who are presently suffering with these kind of issues, hindrances and all that here in GCC? What do you suggest them? Can you just please tell me?
See, only one thing is, they have to be very patient to get pregnant, because they initiate treatment, and once they don't get pregnant immediately, it's just like people trying to reduce weight. People try to reduce weight. If they don't reduce weight, they immediately give up. Same way, they try to get pregnant. If that's not possible, they break. The pause can be for 6 months or 1 year or 2 years, and then again they initiate the whole process again. So this, they have to really understand that infertility is always a race against time. If they lose it this year, the chances of getting pregnant after 1 or 2 years is going to be lesser than what it was this year. So once they are sure that they are unable to conceive, then they have to be consistent with the treatment. Never give up the treatment till they achieve not pregnancy. As he rightly said, get a child in hand, because it's not going to be easier over the years that are going to come. And first, they have to be associated with the right person, the right doctors per se, to know what exactly is the reason for why they are not conceiving first, and what are the best treatment modalities that are available which can make them pregnant. It's like not one treatment can get all the couples pregnant. Each couple have their own issues, and each one should have the treatment pertaining to their issue. So they have to get the best advice from the doctors as to what the best treatment for them could be, and they should pursue it consistently till they get the baby in hand. That should be the real take-home message, what they get out of us today.
Okay, now the thing is, suppose now a lot of couples have already seen this video, and a lot of couples have started already calling to our call center, your call center, which are supported by the doctors, by Doctor on Call and all that. So suppose a lot of patients would like to understand about the food there, because it's like for how many days process they have to come there? Like, what is the basic thing? Like, if they're calling the call center, our doctor will give the complete information and all that. So is it like different couple, different issue have different time they have to stay there? If they're staying there, the other issue is about the food. Will you arrange the local food, what they have been eating here, there? That is another question a lot of viewers must be having in their mind. The other thing what they'll ask is about the language as well, language support as well. So most of the GCC people, they speak in Arabic. So you have Arabic translators as well there?
See, the newly located center, which was fully planned to cater international patients, the next door of the center is the Arab kitchen. To be very, it really helps the specifically people from GCC countries to have a food home at the home food in a distant location. So that is one thing is well taken care. Of course, we have arranged the translators. So any treatment to get completed, they are expected to stay minimum 3 to 4 weeks. Of course, we are going to start our facility here, even for the reason of money or for a medical tourism to explore India. If they are going to come for India, still they can go through the screening process here. They can start the medications. They can be
Okay.
prepared here. So
Okay.
when they are ready, we are going to call them, and it's within 3 to 4 weeks. And if they are going to be willing to stay for some more time, we are advising to stay for some 8 to 12 weeks if possible, wherein we are going to look at the fetal heart, we are going to secure a stitch, and we are going to make them more comfortable and go for a pregnancy at the hometown.
Yeah, so food is not an issue. You understood there is a beautiful restaurant just next to his center where they provide all the Arabic kind of food, Lebanese food and other dishes, variety of food. Okay, now the thing is about the translators. What about the translators? So you have easily available translators also?
Yeah, the translators are available who can speak Arabic.
Okay.
So we are going to facilitate that also, and not only the translators. Apart from that, I'm just telling you, as I suggested, it's a tourism. So I'm not going to make yourself very comfortable. All the facilities, we are having a dedicated guest secretary, guest relations, who are going to assist you round the clock in terms of your shopping, in terms of your free time, because I don't want you to make you feel as a patient or you come for a treatment. So there are so many places surrounding Chennai. There is a Pondicherry, beautiful Pondicherry, and so many Mahabalipuram cultural heritage. So people really like to explore, and they'll be really thrilled to see all these things. We have the world's second largest beach in the world. So everything is there. So they are going to have a very good time, relaxation, as well as a good effective treatment. It's going to be promising for them.
Okay, great. So I must thankful to both of you for coming all the way from India to invite the people of GCC. Being here is a very pleasure moment for everybody here, Doctor. So we were with Dr. Saravanan and his wife, Dr. Mahalakshmi Saravanan, the world-renowned fertility experts and embryology experts and all that. So they have come all the way from India to invite you guys there to the country for purpose of the treatment and all that, affordability and all that. So I request you everybody to just go through the complete video and try to post this as many time as possible on Facebook and all that, and you can tag it to the people who are going through this problem. So it's like you giving them a hope, like to make them happy, like hope to make them happy, like there are a lot of couples who are going through all these problems, all these issues in this whole world. The GCC is one of the major country where you see a lot of this issue is happening. So I request you to post this as much as possible on your Facebook, on LinkedIn, or on Twitter and all that. So thank you so much, and we'll come back again with another specialist. Till then, goodbye, take care.